Hello students, welcome to a discussion of important topic, that is early clinical exposure. Here subtopic is branch chain amino acid metabolism. This is from the topic protein metabolism and very important clinical case for the first professional examination. So your subtopic is branch chain amino acid metabolism. Name the branch chain amino acid: valine, isoleucine, leucine. These are the branch chain amino acid. So we are in the branch chain amino acid metabolism. Now see the important clinical case. A 28 days old infant brought to the hospital with poor feeding, convulsions and vomiting. Poor feeding, convulsion and vomiting. Urine had smell of burnt sugar. So this is the key word here. Urine has smell of burnt sugar. Biochemical analysis suggestive of increased branch chain amino acid and their keto acids in the urine. Arterial blood gas analysis shows low bicarbonate level. What is your probable diagnosis? So as here mentioned, that is branch chain amino acid and their keto acids in the urine, means this case is related with branch chain amino acid metabolism. Now what are the important cases that are related with branch chain amino acid metabolism? The most important one is the maple syrup urine disease. Maple syrup urine disease. This is an important case related with branch chain amino acid metabolism. The urine had smell of burnt sugar, maple syrup or burnt sugar smell. It is a characteristic feature of maple syrup urine disease. It is maple syrup urine disease. This disease is because of defect in the enzyme which converts the branch chain keto acids into their respective acyl coenzyme A. Now the name of the enzyme is branched chain keto acid alpha keto acid dehydrogenase. Branch chain alpha keto acid dehydrogenase is the enzyme which is defective in the maple syrup urine disease. Why there is metabolic acidosis and what is reason for the characteristic odor of urine, that we will discuss. Why there is metabolic acidosis? Because there is production of the branch chain keto acid continuously and elevated level of branch chain keto acid. So these acids neutralized by the bicarbonate. So bicarbonate is utilized for buffering these acids. That's why decrease in the bicarbonate level that causes the metabolic acidosis. So these acids and their amino acids, these can be detected by the chromatography technique, and confirmation can be done by the tandem mass spectrometry. So elevated keto acids can give the Rothera's test positive. Also the elevated keto acids can be detected by the DNPH test, that is dinitrophenylhydrazine test, that can be these keto acids can be detected in the urine. So Rothera's test is positive, DNPH test is positive. Then chromatography, you can assay the amino acids, and tandem mass spectrometry, it is a definitive diagnosis for this amino acid urea. So smell of burnt sugar, it denotes the case of maple syrup urine disease due to defect in the branch chain keto acid dehydrogenase defect. So metabolic acidosis because of accumulation of these keto acids, and bicarbonate, it is utilized for buffering these acids. And what is the reason for characteristic odor of urine? This is because of excretion of keto acid in the urine. Excretion of keto acid in the urine. Now see, in this branch chain amino acid means valine, isoleucine, leucine. So valine, isoleucine and leucine metabolism. So all of you know that leucine is exclusively ketogenic amino acid, and it will give only the fat. So that's why it is known as ketogenic amino acid. Isoleucine belongs to both glucogenic and ketogenic, so it will give you glucose and fat both. And valine is only glucogenic amino acid, it will give you glucose. Now this amino acid, branch chain amino acid, they are converted into, we'll discuss in short the branch chain amino acid metabolism. This valine, isoleucine and leucine, they are acted upon by the amino transferase or transaminase. They are acted upon by the enzyme transaminase. This is a PLP dependent reaction. Transaminase, amino transaminase. This is pyridoxal phosphate dependent reaction, and this branch chain amino acids, they are converted into their respective keto acids. So just remember this, respective alpha keto acids are produced. By the transamination reaction, respective alpha keto acids are produced. In the transamination reaction, it combines with alpha ketoglutarate to form the glutamate. So respective alpha keto acids are produced. Now the enzyme, the important enzyme, that is branch chain alpha keto acid dehydrogenase will act on this, and this will convert this alpha keto acids into respective, it will convert this alpha keto acid into respective acyl coenzyme A, respective acyl coenzyme A. Now this acyl coenzyme A is converted into glucose through the various steps via the valine. It is converted into glucose and fat from the isoleucine, and only it will give the fat from the leucine. Via the different steps or multiple steps, but these are the common steps to this branch chain amino acid and their keto acids. Now this is due to the maple syrup urine disease. It is due to defect in this enzyme, that is branch chain alpha keto acid dehydrogenase. It is a multi-enzyme complex. It is composed of 3 enzymes and 5 coenzymes. So 5 coenzymes required for this, 5 coenzymes. So see, like pyruvate dehydrogenase complex, it requires 5 coenzymes, that is thymine pyrophosphate, then lipomide, coenzyme A, FAD, and NAD. These are the 5 coenzymes. The 3 enzymes are in this branch chain alpha keto acid dehydrogenase. It is like a pyruvate dehydrogenase complex. So E1 is here, E1 alpha and E1 beta is branch chain keto acid decarboxylase. So branch chain keto acid decarboxylase is the E1 here in the branch chain keto acid dehydrogenase. So branch chain keto acid decarboxylase is the E1. E2 is dihydrolipoyl transacylase, and E3 is dihydrolipoyl dehydrogenase. It is like a pyruvate dehydrogenase complex. So classical maple syrup urine disease, it is due to defect in the branch chain keto acid decarboxylase. Also dihydrolipoyl transacylase and dihydrolipoyl dehydrogenase can cause the maple syrup urine disease, that is known as type 2 and type 3. But classical, it is because of branch chain keto acid decarboxylase, or in short you can say branch chain keto acid dehydrogenase complex deficiency can cause the maple syrup urine disease. So this is important disorder related with branch chain amino acid metabolism, where there is increased level of this branch chain keto acid occurs, and elevated levels of this branch chain keto acid gives the maple syrup like smell. Maple syrup like smell. The characteristic features or neurological manifestation, there is bout of hypertonicity followed by the flaccidity. So it is like a boxing and bicycling posture is given by the child, boxing and bicycling, because of hypertonicity and followed by the flaccidity. So intellectual disability is there. This is very fatal condition, and death at early age occurs in the maple syrup urine disease. See the case. 28 days old neonate brought to the hospital with poor feeding, convulsions and vomiting. So convulsion is there, seizure, convulsion, intellectual disability, hypertonicity followed by the flaccidity. These are the symptoms. Also there is metabolic acidosis, because elevated levels of the alpha keto acids in the blood, that causes the metabolic acidosis, that causes the vomiting like features. So there is metabolic acidosis, and characteristic characteristic maple syrup smell of the urine. It is because of the excretion of alpha keto acids in the urine. So this is a fatal condition. Life expectancy is very less. Intellectual disability is there, and the characteristic feature is smell of burnt sugar, because of deficiency of branch chain alpha keto acid dehydrogenase. So this is all about the maple syrup urine disease. Keep watching ECE series. Thank you.